guys, welcome back to RHP. It's your girl Ronji, and today I wanted to share something. I wanted to share my obsession with matters health, okay? Weight loss, eating right, taking lots of water, eating fruits, everything that concerns health. I want to share with you in a minute why I'm obsessed with it and why I'm on this path to, encourage you to be obsessed with it as well, okay? I know obsession is not a good word, but when it is used in this context, I guess we can use it, okay? I guess you can go ahead and use obsession because that is what I am. I'm obsessed with matters health. And so I want to share why, and this is why. Oh, wait a minute. Before we do, let me welcome those who are joining us for the first time. Thank you so much. I don't take your presence in here for granted. Go ahead and subscribe. RHP, in other words, Ronji Health Pips, gives you nothing other than good health content that could be beneficial to yourself or to somebody that you care about. So go ahead and feel at home. They say when two people are running, one is running from something that is life-threatening to them, and the other person is running. Let's say person number one is running from something that is life-threatening. Person number two is running towards a reward. They're not going to run the same, okay? And your guess is as good as mine. The one who is going to run faster is the person who is running away from a life-threatening thing, okay? And so my obsession with health started when I had two conditions. One I've shared on this channel before. I've talked about when I was diagnosed with diabetes, and actually it was a pre-diabetes condition, okay? I was heading there. I was heading towards being diabetic, and I did something about it. I didn't wait because I know the struggles patients go through, especially those who are diabetic, the kind of challenges they face. I didn't want to go through all that, and I'm sending my prayers and my support to everyone out there dealing with diabetes. It is not easy. It is not easy. If you have somebody you're taking care of who is diabetic, please give them all your support because it is not easy to live with the condition. And so that I've shared. Something I've not shared is a condition which I don't even know its name. I couldn't wait, I couldn't hang around to find out what it was because to me, it didn't sound funny. It didn't sound like something I wanted to find out what it was. And so I've been running away from those two conditions. And the second condition, which I didn't get to find out what exactly it was, we didn't get to reach a diagnosis of it. The symptoms didn't look good enough for me to even, hang around and find out what it was. And so when I was big, you all know when I was big, I've shared my pictures before, okay? When I was that big, at a certain point in my life, I had very weird symptoms. I would lie down on bed and then I would start feeling some sharp pains on the left part of my chest. Even if you didn't do biology, you know what's there, okay? You know that your heart is around that place. And so the pains were consistent every evening, sometimes even during the day. And I didn't like it. It was uncomfortable and it was very painful, okay? It's a pain that could linger for about 30 seconds to 1 minute. That's too long for that kind of pain. I know 30 seconds is, a very short time, but if you're experiencing something painful, it feels like a day, it feels like a whole month. And so it was very, very uncomfortable. And when I talked to my doctor about it, you all know my doctor? I've mentioned my doctor in here so many times, I don't feel like, okay, I'm gonna throw out his name. When I talked to Dr. Lube about it, he said it could be two things. One is pneumonia. Another one, he didn't give it a name, but then he said we might need to do an ECG. Now, an ECG is a test that, is done on your heart to figure out whether it's functioning correctly, whether it's working the right way, whether it is in good condition. And that's when I raised all my eyebrows and all the hairs on my body. I was not ready to go and do that kind of test. One, because I feared that it could show the worst that I was fearing. And so I gave it time. I said, okay, we will plan and do it, but then don't do what I did, because when a doctor suggests that kind of test, please take it seriously. I'm not here to encourage you to ignore any advice on that. Let me say that again. If a doctor sends you for any tests, any scans, any x-rays, do them as soon as possible. Do not ignore it, okay? I gave myself time because I think fear was in play. So I didn't do it immediately, but then I decided to do something else. Instead, I decided, how about let me try to lose some weight, okay? Let me try to live a healthy lifestyle. Let me try to, stop taking additional salt with my food, do some exercises, and my favorite is dancing or jogging. Let me eat more of vegetables. Let me avoid a lot of carbohydrates. I did something towards it because I thought, okay, if it's going where it's going, then let's reverse it before we even know what it is, okay? And so I'm glad that the efforts I put in trying to, reverse the unknown condition we were facing, they paid off, because as I'm speaking today, it's been a year of not experiencing the sharp pains, and I'm relieved, okay? I'm relieved because now I'm thinking I'm well, which is something to be proud of, something to, encourage others to do, because some of these conditions, some of these lifestyle related conditions can be avoided. It depends with what you want to do with it. You can avoid them by, starting to live healthy, by adapting to healthier lifestyles out here, exercising regularly, eating the right kind of food, taking enough water, avoiding what you need to avoid, which we've talked about on this channel. And so I'm glad that it paid off, and I'm out of the threat, okay? Whatever it is that it was, I'm not heading towards its direction. I've run away from it. And so my question this evening is, are you into matters health? Are you taking your health seriously? Do you love whenever a discussion of health is brought about? Is it something that excites you, or it's something that puts you off? Is it something you want to try? Is it something you are into already? Because I meet a lot of people, they're also into health stuff, jogging, eating right, and I get excited. I feel happy because I know they are doing the right thing. Are you one of them? You are waiting for a doctor to, give you a prescription that says you need to be exercising 5 days a week. Are you waiting to reach that point? Because I believe it is better to avoid than to treat. It is always better to prevent than to actually treat. When it is prescribed down that that is how you should live your life, then it becomes a burden. You'd rather enjoy doing it when it hasn't reached a level whereby you are actually required to do it. And so I'm here to encourage you, if you haven't thought about your health seriously, this is the right time. Take time, because nobody wants to die early. Nobody wants to, lose their lives prematurely out of situations they would have prevented by living right. And so I hope the message gets to you. But if you're one of the people who are health enthusiasts, you are trying to do your best in order to, maintain a healthy lifestyle, let me know in the comment section. What is it you are doing? What is it you are running away? What is your biggest motivator? Share with us in the comment section. Let us know what you are running away from, and let us have fun while doing so. If you haven't thought seriously about your health, this is the time. Maybe you can share with us what's holding you back. Sometimes it's just not time for you. You are going through some things and you haven't taken your health as serious as you need to. If you're going through some things, let us find you help. We have a lot of, providers with us supporting this channel. We have therapists, we have doctors that we've spoken to, whom we can reach out to and, have you sorted if it is something they can take care of. So share with us. If something is holding you up and it is medical, let us know in the comment section. Reach out to us in the email address and let us find a way of helping you so that we move together towards good health. That was all for today. I'm excited having this conversation with you. I'm going to meet you again on another episode. And until then, God bless you so much.